Oh, what time is it in Myanmar, Han? We'll do this more routinely. We'll do it maybe once a week. We'll try to do it in the different languages, Bahasa for our Indonesian patients, and then we'll have one in Mandarin as well. In the midst of preparing. So after this trial session, I suppose we'll have more confidence. Hi, Bapak Henry. Apa kabar, Bapak?
Say that we're also live on Facebook, they can share with their friends.
We're also live on Facebook. You can share this with your friends. For those who are not, just text them to go on our SMSC Facebook. Hi, Trisha. I will reply to your message later. Do not panic. The medical clinics are still open. We are still operational. So if there's anything, just give us a call. You can still come by to see Dr. Lim for Singaporeans. For non-Singaporeans, always call us, text us, email us. We are trying to courier medications, still in the midst of doing stuff. So we need a little bit more time. We don't know how long this pandemic will last, but we are here for you 24/7. So we'll get Dr. Lim live in about 2 to 3 minutes. We'll just hold on for more people to join in. Good morning, Mr. Simmons. Thanks for coming in. Yeah, we're just still waiting for people to connect, and then we'll start shortly. No, Antonio, I can't listen to your voice. You need to text your queries. There's a Q&A button at the bottom where you can text.
Or you can just type in the chat.
Pagi Bapak Suging sama Ibu Sri. Apa kabar Ibu? Apa kabar Bapak? Mungkin minggu depan ada di bahasa lah. Hari ini try dulu di English ya. Nanti minggu depan ada bahasa sama Cina juga. Sekarang udah ada 80 orang. Saya mau tunggu sama 100 orang. Nanti bisa di start dulu ya. Yeah, initially we were advised not to wear masks, but I think it's safer to just put on a mask so that we don't spread if we are symptomatic. And even if we have a virus, flu, we don't spread it to other people, don't decrease their immunity. So just wear a mask for yourself, for your family, and for the rest. Okay, we're almost there. I think in about 2 to 3 minutes. We've got about 90 participants now. We'll just reach the 100 mark and then Dr. Lim will go live. Dr. Lim put in a lot of effort to prepare his slides. He's happy to see all of you supporting us, and we will go through this together. For Singaporeans, stay home, stay healthy, stay safe, pop in your vitamin C's, drink lots and lots of water, Dr. Lim will advise same things as well. And hopefully Dr. Lim can come out with a miracle immune booster pill, which we will crack our heads on to make sure we keep you all alive till 100. Yeah? Okay, we'll start in a minute. So just count down a minute and we'll see you all folks in a minute. We have sent some medications to Jakarta, to Indonesia. Give us till Monday. If the first round goes through, I will text the rest of you how to go about getting medications from us, yeah? But cold chain items, injections and all are still banned, so that will take some time. Hi, Dr. Lim, morning.
Hey, good morning, good morning. And
A
good
lot
morning
of
to
our
all as
regular
well.
patients with us, Dr. Lim. So they've
Yes.
got 100 people now. I think the rest are on Facebook.
Yeah, I think COVID-19 is a worry for everybody. And of course, there's a lot of news out there. And I think a lot of people are wondering what's true, what's not true, and how to distinguish between the facts from the fiction. So today, I want to share with you some of the information. About 2 weeks ago, I was invited to be a panelist on an internet webinar like what you have now. And there were about 2,000 over doctors, including doctors from China, who were at the front line of the COVID-19 epidemic in China. And they shared with us, I did a presentation, and they also shared with me their experience and all that. A week ago, I attended an even larger meeting involving more than 10,000 doctors from China. Again, we had an in-depth discussion about the COVID-19, and they are sharing with me their real experience with handling COVID-19 and what are the things that for doctors, what we need to look out for and how the disease behaves. So today, I thought that I will share with you some of this information, which I hope will be useful to you. I will try to make it very simple. Obviously, in this webinar, I cannot cover everything about COVID-19, but I'll try to discuss those points which are relevant to you in your day-to-day life. So I think without further ado, I'll go straight into the presentation, and then subsequently there'll be a Q&A session, and I'll be happy for all of you to ask me any questions. Share slide now. Listen. Okay, so today my focus is on, for all of you, how to stay safe in this COVID-19 crisis. So firstly, a little bit about COVID-19. So this virus is actually, in a way, belongs to what we call the coronavirus family, and it's not so different from the SARS virus, which we all experienced in 2003. And SARS had a mortality rate of about 10%. Then we also have a MERS coronavirus, which has a mortality rate of about 30%. So there is some similarities with some of the previous viruses that have actually affected people in different parts of the world. Now, this sounds a bit technical, but I need to make it, I try to make it simple for you so that later you understand why some of these lifestyle measures that we're going to take are important. So if you think of the virus as a key, that means the virus is like a lock and a key. So the virus is a key, and the cell must have a lock for the virus to open, like a door for the virus to enter the cell. So this virus is like the key, and the protein on the virus that is so-called the key is called the spike protein S, all right? Now, this protein must fit nicely into another lock protein on the cell of the host. That means, for example, the human cell. And the lock protein is called the ACE2 protein. So these two components must be present for the virus to enter into our body. In other words, we must, the cell in our body must have this ACE2 protein on the outside for the virus to unlock the door and get into our cells. Now, this particular protein ACE2 is usually has cardiopulmonary protective function. It has a protective function. So you find that ACE2, this particular protein, the lock protein, is present in high levels in the elderly people, those with heart problems or lung problems as well, and those with high blood pressure. And therefore, it's not surprisingly that if you read in the newspapers, that many of the people who are unfortunately succumb to this problem usually have a heart problem, they have a high blood pressure, they are elderly. Part of the reason is because they have more lots available, and this allows more virus to enter into the body as well. Now, there is another topic which actually there's intense discussion at this point of time, because some of the blood pressure drugs we use at this point of time actually can increase the expression of ACE2. In other words, when you use these blood pressure drugs, cells in our body, some cells in our body will have increased production of ACE2 proteins on the surface of the cell, which means that actually you would actually increase the likelihood or increase the susceptibility of the cell to the virus. So there's a lot of discussion as to whether we should continue these drugs or discontinue these drugs. The European Society of Cardiology had issued a statement to say that no, there's no impact. But honestly, we really do not know for sure. Whereas the Chinese investigators who have large experience from the epidemic in China have different views. But at this point of time, we are still not very certain absolutely whether we should change the drugs or we should just continue the drugs, because there are different views with regards to this. So what should you look out for if you think that you may at risk of the virus? The commonest symptoms are fever, tiredness, and dry cough. But the good news is that about 80% of people will recover without needing any treatment beyond rest, drinking enough liquids, and taking some fever medicine. That's all you need for most people. Unfortunately, for a small percentage of people, it can be fatal, all right? And as I said earlier, because the older people, those with lung problems, heart disease, or those with vascular problems like diabetics, they are the ones that are more likely to become severely ill because they are more likely to produce this particular lock protein, which allows the virus to unlock the door to the cell. So according to the World Health Organization, 4 symptoms that you need to look out for: cough, fever, and tiredness. And usually in these patients with a fever, their fever can be quite high. It could be 39 degrees. So it's usually not a mild fever. And sometimes this fever can last for like easily more than 2 weeks. And you may or may not have a cough, a dry cough, and you may feel tired as well. Now, by the time you start feeling difficulty in breathing, means it's very serious. So the moment you find that you have difficulty in breathing, or you feel that you've got a chest tightness, a very persistent pressure on your chest, it suggests that very likely your lung is affected and you should seek treatment. By the time you are confused, means that the lung is so severely affected that you don't have enough oxygen to the brain. Or if you turn blue in your lips or face, means you really don't have enough oxygen in the brain because the lung is badly affected. And generally, we will try not to go to the hospital at such a late stage, but at the earlier stage. Because by the time you go to the hospital at such a late stage, you are almost very likely high risk that you will need a ventilator care. By the time the risk of death is quite high. So unfortunately, there's currently no vaccine, and the best way to prevent the illness, obviously, to avoid being exposed. And virus is mainly thought to spread mainly from person to person, those in close contact. I will go through this with more details later on. And through respiratory droplets produced when an infected person coughs, sneezes, and talks. I will talk about more of this later on. And these droplets will land in the mouths or noses of people who are nearby or possibly inhaled to the lungs. But recently there have been studies, including studies in Singapore, that have been published to show that the COVID-19 can be spread by people who are not showing any symptoms. In other words, these people may be perfectly well, no symptoms, but they may actually be spreading COVID-19. And you'll be surprised that if you talk very loudly, or you sing, or you talk with great force, actually that will increase the rate of emission production of these air particles containing the virus. So an example was a choir that had, in fact, had pre-symptomatic transmission affecting choir members. So this is a study done in Japan. You see two people sitting here talking to each other. This is about the usual distance most people when they sit down and talk to each other. So they did this, Japanese doctors did experiments, and you show that when they talk, they have a lot of respiratory particles. So this person is sitting here, the face is here, this other person is here. You can see when he talks, there are a lot of respiratory particles, a lot of respiratory particles. The only thing about these particles when you talk to each other is that the louder you talk, the more respiratory particles are produced. Most of them are not the very fine particles, so they generally settle within the place where you talk. So during this period, maybe when you talk to your friends and your friends talk to you, maybe you should talk in a softer tone and not in a very loud voice, so that there's less likely of respiratory droplet spread. Now, beyond just direct transmission from person to person, be careful that these viruses can actually spread through indirect transmission through fomites. Fomites means any object or materials which are likely to carry infection. Could be clothes, utensils, and furniture. All right. And of course, as I said, spread by droplets or to contact with an infected, contaminated hands through non-rigorous hygiene. And therein lies a reason why we should not shake hands. We should wash our hands frequently. Now, when you want to wash your hands, there are two things. Number one, if you want to use soap and water, the rule of thumb is that it takes about 20 seconds because you want to really clean off the virus and wash it off completely from your hands. Now, if you want to use a sanitizer, make sure that the brand you buy, whatever brand it is, there must be at least 60% alcohol. This is the the simplest way to clean off the virus from your hand. But make sure that you rub it along the entire surface of your hand, and you rub them until they completely feel dry. And always remember this is a very, very important point in this period. Please do not touch your eyes, nose, and mouth with unwashed hands, especially after you've come in contact with a crowd or you've gone outside and touched surfaces. Be careful. So now this social distancing, which means keeping away, avoiding close contact. What is the science? What is the reason why people should do this social distancing? Because remember that there are some people without symptoms who can spread virus. So keeping away from people is always a very good principle at this point of time. Avoiding crowded places, avoiding gatherings. So the science of social distancing. So if one person behaves the way he behaves, and let's say he is an infected person, contagious, in 5 days he will spread to 2.5, and in 30 days, you look at this, 406 people. So that is if you behave normally. But let's say you keep very strict social distancing. For example, mainly staying with your family members and avoiding contact unless absolutely necessary. You find that even if you're contagious, in 30 days, only 2.5 people get infected. So that's the importance of social distancing. So all of us can play a part during this period. Now, when you breathe out, even the droplets can travel up to about 1.5 meters. All right. When you cough, the speed is 10 meters per second, and it can go beyond 2 meters. All right. Now, when you sneeze very loudly, you can find that it can even go beyond 6 meters. All right. And of course, the droplets come in different sizes. The large droplets, all right, which tends to settle, or what we call the aerosol, which are very small particles, less than 10 micrometers, which can actually float in the air and stay for some time. I will show you some experiments later on, and you will be amazed at how these aerosols or micro droplets will travel. So this is another experiment done again. So you see a person here, again he has sneezed. So that is the droplets when he sneezes. Then you see this from the back of his head, the big spray of droplets, all right? Then you see that subsequently these droplets are here. And then when these big droplets settle, you find that you have all these small aerosol micro droplets that tend to stay suspended in the air and float around for some time. I'll show you another study done. So again, you can see at 0 minute, this person sneezes, all right? And then you see at 5 seconds, 10 seconds, 20, 30, 40. So this is in a poorly ventilated room. So if you happen to be attending a meeting or gathering lots of people and the room is not well ventilated, the doors are all closed, windows are all shut, this is what happens. Even in 50 seconds, you see the droplets are still floating. Now the yellow and the green and the blue are the larger droplets. The red ones are the aerosol, the micro droplets. Now let me show you what happens to the micro droplets. So again, at 0 minutes, all right, a sneeze, all right, and then at 1 minute plus, you see it starts to circulate. At 5 minutes, it's still circulating in the room. 11 minutes, 15 minutes, and 20 minutes. So even at 20 minutes in a poorly ventilated room, this aerosol micro droplets can still be floating around and causing people to be infected as well. So it's important at this point of time to avoid being present in a poorly ventilated room. And if you need, and all you need to do is actually open your windows, and as long as the windows are open and there's good flow of air through, actually the micro droplets can be cleared very quickly. And this has been shown in experiments as well. Okay, the next question, and this debate about should you wear mask, should you not wear mask, are masks useful, what kind of mask? So let me just share with you some of the signs of these masks. So should we or should we not wear masks? So as you all are aware that in China, it's mandatory to wear a mask when you're outside the house. And I think that has to some degree helped them contain the problem very quickly. So just now I explained to you that this particular lock protein, that means the lock that is needed for the virus to attach itself to get into our cells, it is mainly present in the nose. So it's called nasal expression, mainly present in the nose. So you can also infer that this particular virus, which occurs through a cough and sneeze droplets, and most of it will land in your nasopharynx. Nasopharynx is the area of your nose and your throat, all right? And this is where most of the this particular lock protein is. So that allows the virus to attach and then enter into our cells. So what it means is that if we can actually prevent this droplets from getting into our nose by a physical barrier, then we could potentially reduce this route of transmission, all right? And as I said, most of this particular protein is present in the nasal cavity. So some studies have showed that this virus can be readily detected from nasal swabs because it is present primarily in the nose, all right? And compared to the SARS virus, it appears much earlier in the nasal swabs and at higher concentrations. So the detection is actually quite easy through nasal swabs, all right? And we show that from the studies that this virus is active and replicates in the nasopharynx, unlike other viruses which tend to go to the deeper parts of the lung. So the nose and the throat area is where this virus likes to be in, all right? So this may explain why in the early stage, even when patients have no symptoms, you can already have a positive test. And sometimes there are some reports that people cannot smell well when they get infected, all right? So what it means that if we can avoid the large droplets, which cannot enter the lung but tend to land in your nose area, that might be a very effective way to actually prevent infection. So if you look at the nasopharynx is this area, all right? So the large droplets, let's say if somebody causes or sneezes and you unfortunately be quite close and you breathe in the large droplets, for example, these droplets will mainly settle here. Whereas for the airway and the lung tissue, only the smaller particles like the aerosol will reach lower down, and the smaller ones will get stuck here. But most of them will land here. And this is the area where I told you that the protein, which is the lock protein for the virus, is mostly concentrated in this particular area. So if we can actually try to prevent this big droplets from getting into our nose area, we would be able to some degree prevent that from affecting us. Now, the standard surgical mask can do that. Obviously, for the smaller ones, you will need what we call an N95 mask. So the surgical mask is the one that usually you will find in the pharmacies and it protects against infectious agents transmitted by droplets. That means the ones that actually go into your nose. All right. Now, if you are a contagious patient, if you're a patient, if you wear this mask, again, it will help you to prevent it from contaminating the environment and your family members. So if you're not well and you're wearing a mask, actually that's a good thing, because for your friends and for your family, it's actually useful. Now, these masks generally, based on the manufacturer advice, do not work. I mean, they're not so effective after 3 to 8 hours. So generally, most of the time, most people manage it with masks a day. Obviously, with the mask shortage at this time, but looking after the mask well is important. So if you're wearing a mask and let's say you're not using it, it's actually not a bad idea to put it in a plastic cover, a Ziploc plastic cover, and take it out to use later on. And usually by doing that, most masks can last for 1 day. Now, a respirator, which is a different type of mask, they are better in the sense that they can prevent dust, smoke, mist, and also viral agents as well. All right. So, so you must understand that these masks are for different reasons. So surgical mask is more useful for preventing inside to outside. That means in the direction of exhalation. That means they're actually very useful for trying to prevent or reduce the infection from the person who's sick and infecting those around him. All right. Whereas when you test what we call an N95 mask, or what I call an FFP mask, then we are looking at preventing the agent or the virus from getting from outside to inside. So different, so slightly different. This is from inside to outside. That is from the outside environment to the inside of your face. Now, so the European standard, so most people use this standard. So just to help you understand, if you're buying masks, what all these masks mean, all right? So actually for most people, FFP mask, FFP1 is actually good enough. So basically this is full facial protection. That's what I mean, FFP. And it can filter at least 80% and leakage to the inside maximum 20%. This is good enough. But for medical personnel, we will usually use a FFP2 or FFP3 mask because our contact, the risk of contact with patients with the viruses is much higher. So they need masks which are actually better. So actually a contagious person should wear a surgical mask. That's good enough. In other words, if you're not well, you don't really need to wear an N95 mask. All you need is a standard surgical mask. And, if you're not sure, just wear a mask. That's the best, And for caregivers, obviously, as I said, you need an FFP2 or FFP3. You need an N95 mask. Now, so just illustration here, for example, if you look at this, if you use a homemade mask, all right, and you're wearing it to protect yourself from particles outside. For every 100 particles outside, 33 will leak to surgical mask 25, and of course, N95 will be 1. Now, if you are coughing and you're wearing a mask, if you're wearing an N95, still some particles get in. Surgical mask, yes. And obviously, even with the cloth mask, unfortunately, it is, unless depends on how it's made. Obviously, if it's made with more layers, better material, then this will be reduced as well. All right. This is another slide to just show you, in terms of, obviously this N95 is what doctors use, really not necessary for the lay people. It's not easy to use and it's really not very comfortable. A surgical mask, of course, if you can get it, is a good, it's actually a very, very useful for you and for your family, because actually they can prevent reduction of significant amount of virus load. And this is a FFP mask, all right? So these are all quite identical for this grade of mask. Now, if you cannot get these masks, and you can get the standard mask outside, I think for the viruses here, even though, as I said, depending on the cloth mask, if the cloth material is less porous, you might be able to prevent more droplets from going out. And also, it will be difficult for the droplets to travel out very far when you sneeze or cough. So actually, the purpose of this mask is to actually prevent asymptomatic or those with symptoms from spreading to others. So it means that the long and short of all this is that it is actually better to wear a mask rather than not wear a mask, because in summary, most of the viruses are in your nasopharynx, your nose area. And the way people spread it is someone coughs and some big droplets lands in your mouth because you breathe in or breathe in through your nose, and it gets lodged there, then it can actually find the lock protein for it to get in. So if you can prevent that, actually that's very, very helpful for you, and actually so if two persons wears masks, then the likelihood of transmission will be very, very low. So I go to some simple day-to-day things. So obviously at this point in time, a lot of people are buying online deliveries because people are more fearful about going out except to do essential things. So is it safe for you to go and order online and all these packages come in? Are you going to get infected from all these packages that come in? Do you need to sterilize them? Well, the answer is actually not really, because these viruses cannot survive too long on cardboards or even on plastic. So by the time the deliveries reach you, it would, in most cases, be more than 24 hours if it's on plastic, unless you're talking about food, but most times the delivery may take longer than 3 days if you are using overseas deliveries. So usually by the time it reaches you, it's unlikely to have a active virus on top. But if you are very, very worried, spritz, you can take just a short forceful spurts of solution containing alcohol. Just rest it for a few minutes before you wipe it off. And then after that, just remember that after you open the box, just remember to wash your hands again. Don't touch your face. Then you'll be fine. You'll be fine. So, so according to UPS, the low risk, even if you take now, so this was when China was at risk. Now China is not at risk. So it's mostly from overseas, non-Chinese sources. It's very safe. So not to worry, not to worry. Okay, now I think many people are worried about, what should you do? How should you disinfect your area? So in fact, I read a news article very interestingly, so about a doctor. And this doctor was saying that he was so worried that every day he takes a bath with a chlorhexidine. But let me tell you that although chlorhexidine is commonly used by doctors to disinfect the skin when we do surgeries and all that, unfortunately, chlorhexidine, unfortunately the doctor didn't know it, chlorhexidine does not kill the coronavirus. Does not kill the coronavirus, all right? So what I'm saying is that it's not that all disinfectants that we use in hospital or that routinely use are effective. All right. So let me just share you so you don't worry about the brands and all that. That's not important. But actually, more importantly, is for you to look at the content. So generally, if you have hydrogen peroxide, you have these acids, or you have quaternary ammonium. Most of these wipes work, or you have sodium hypochlorite, which is actually more like a bleach, all right. So these wipes generally will kill the virus, generally bleach solutions and acid solutions. Again, another set of So just now, those are wipes. These are what called ready to use. That means you just buy them. You don't need to dilute them. You can just use them. Again, you look at the content. Most of them have sodium hypochlorite, which actually bleach, all right? Or they have this, ammonium, all right? And acids. Usually, it would be acids. These are all the ready to use. And of course, alcohol is very effective as well, all right? And here, if those for diluted or pressurized fluids, same thing, you look at the combination, hydrogen peroxide, ammonium, hydrogen peroxide. So these are the common contents, sodium hypochlorite. So the acids, this and that. And of course, as I said earlier on, anything that has 60% alcohol and above, that can be very effective as well. Okay, so same thing, just to show you again, for those that are dilutable, all these different brands, you can look at it. But similarly, the contents are the ones that you need to pay attention to. Now, but be careful when you use disinfectants, because they are all actually quite harmful to the skin. So preferably, you should read the precautions carefully. Wear gloves, or sometimes you need to make sure that you're protected as well. And try to keep the children away from this when you're applying disinfectant. For example, if your house, you had a visitor and then you're worried whether there's infection and you want to wipe it off, keep the children away, open the windows, ventilate, and get it out. And remember that after you use any disinfectant, remember to wash your hands, including surface wipes. And keep your lids tightly closed after that, so that the fumes do not come up, because sometimes they can evaporate. And very, very important, do not allow children to use disinfectant wipes, because they don't understand. They may take the wipes, touch their face, touch their eyes. So please do not let them use that. And please throw them away. And remember, do not use them the way we used to clean our hands and the baby wipes. So, you can buy from the supermarket those hand wipes and baby wipes. Now, most of those are not really disinfectant wipes, all right? So those you can do it quite safely. So don't treat the disinfectant wipes as if they are baby wipes or hand wipes. Okay, so I thought I will just stop here, and then I will take any questions that you all may have. And I'll be happy to answer any questions.
Hi, thank you all for listening so patiently. We'll take questions now. You can either type your questions. Okay, we have one question, Dr. Lim. So, are swimming pools safe?
Yes, because swimming pool we use chlorine. So chlorine is actually, when you put it into water, there's some acidic component to it, and so it's quite safe. Chlorine is swimming pool is safe. I mean, unless your pool is not chlorinated, but by and large, it should be safe.
All right. So do these symptoms happen progressively, as in coughing more than fever, then more than shortness of breath, or do they come in a different order?
Okay, so usually if you have symptoms, quite often the first presentation is fever. And this fever you'll find is actually quite high. It's about 39 degrees centigrade. And you may find that you may not have cough at all. And the fever, even if you took your Panadol or, your fever medicine, you find the next day is still 39. The next day is still 39. The day after that is still 39. So this fever doesn't seem to settle no matter what Panadol you take. And sometimes it will last more than 2 weeks. Now, usually most virus flus, will last within a week or so, at worst 10 days to 14 days. But this particular virus will tend to last much longer. You'll find this fever does not settle. So the first thing you find that if you have very high fever, and you have been in contact with someone which you think may be exposed, or you've been to a place where there's a record of patients being infected, and then you start to have a cough. Quite often the cough is a dry cough, then I think it's wise to get yourself tested. Today we don't have. I didn't want to make the presentation too long, so I didn't go into the different types of testing and all that. Yeah, but certainly fever, high fever, 39 degrees centigrade, not settling even your Panadol. You have to be quite careful in this period of time. Now, by the time you feel that you have, like some of the patients I've spoken to, they feel this chest very heavy, like chest tightness, then you definitely need to see a doctor for sure.
Okay, next question, Dr. Lim. If you have a virus in the nose and the throat, besides infection, what do you think? Does it mean you're a carrier or something? If it's a persistent throat infection.
Okay, I mean the depends on the availability of the test. Obviously, not every place has access to test kits because there's significant limitation of test kits. But I think if you have high fever, you have a persistent and you've taken Panadol for a couple of days and you're still not well, my advice is actually to get yourself tested. Now, there are two ways to test it. Now, one way to test it, obviously, if you have the COVID-19 test kit, is to test directly for COVID-19. However, I know that many places don't have the COVID-19 test kit. So what you can do is you can ask your doctor to do what we call a PCR test using other viruses, so by exclusion. So they have actually what we call PCR array tests, which in other words, with one swab, they can test for multiple viruses. That means the standard flu viruses and all that. Now, if you have fever and sore throat and you tested for all these viruses and they are all negative, then you, by exclusion, there is a very high chance you have a COVID-19 infection. So for those places where you don't have this test kit, then you should try this other way. In other words, you test for all the other viruses, and if they're all negative, then you are very likely that you have COVID-19.
All right, Dr. Next question. Using nasal sprays to clear your nose or keeping air purifiers in your room, does it make a difference, or in your workplace?
Okay, so I think the most important thing is, just now I highlighted a few things. I think if you are in this period of time, my advice, if you are going out and you're going out to, especially where you're going to come in contact with people, my advice to you is wear a mask. Wear a mask. I mean, if you're going out to the big park and there's nobody there and you're very few people, you're walking, fine. I think that's fine. But if you are going to a place where you're going to have people around you, my advice, wear a mask. That would be because prevention is the best. Because by the time the viruses gets into your nose, you may not even have any symptoms. But certainly keeping the workplace well ventilated with good social distancing, with good hygiene habits, definitely that would be a help. That would be a help. Yeah. But the key thing, as I said, before you touch your face, your nose and all that, keep a hand sanitizer with you. Always make sure that you clean it first before you touch your face and nose. Yeah.
Okay, Dr. Next is flu vaccines. Flu vaccines, pneumonia vaccines, are they useful in protecting us against COVID-19?
Okay, so at the moment, don't forget that even with the COVID-19, the other viruses are still around. It's not like they are not around; they're still around. Now, all these viruses, why do we get all these deaths? Because they are all viral pneumonias. So if you actually read the US CDC report, Centers for Disease Control, in the month of October last year to January this year, they had about 6,800 deaths from influenza. So what it tells you is that influenza can also cause patients to die. So it doesn't mean that if you you will not get other type of viruses. So I think for those who are more susceptible, has multiple medical problems, has of an older age, I think it is still wise to get a flu vaccine. Yeah, because as I said, even in the US, in 3 months they had about almost 7,000 deaths. Yeah.
All right, Dr. Lim, next question. Chest X-ray versus a CT scan for the lungs. If we can't have blood tests done, can we do those two?
Okay, so you can do both. Now, obviously there'll be some experience required to a chest X-ray will show up pneumonia, all right. And then the CT scan. The important thing about the CT scan is that there is what we call AI software. So because of the need in China, because there were people getting pneumonia, so they had to try to distinguish between what is COVID-19 pneumonia vis-a-vis what is other types of pneumonia. So now there's an AI software. So for example, our center, we are working with this collaboration between the Singapore, UK, and China center universities. So we have this software which will help us distinguish whether if you have an infection, pneumonia, you take a scan, the AI software can tell us whether you are likely to have COVID-19 or other types of pneumonia.
Okay.
But a chest X-ray would be the first thing. And then if there is a patch, I think a CT will be useful.
A low dose CT. Patients are asking, okay, so you have your latest technology in your center. Can we do a low dose CT scan? Is it safe?
Yes, so we can do that, but more importantly, we as I explained to you, we are probably the first center in Asia outside China to collaborate with this research facility, which comprises Singapore University, UK University, and the Chinese Tsinghua University. So during this crisis, there was a need for this AI software to distinguish different types of pneumonia, including COVID-19. So this is already used in China, and we will be one of the first centers to have this in our place here to help us distinguish between the different types of pneumonia. So whether this will be COVID-19 pneumonia.
All right, Dr. Lim, lots of questions coming in. Okay, now on drugs. Plaquenil, hydrochloroquine, is it safe, effective? Ibuprofen, Advil, safe, effective for COVID-19?
Okay, so there are a lot of drugs being tested out on this COVID-19, and obviously, I think the biggest question is whether hydroxychloroquine or chloroquine or plaquenil, which are all types of chloroquine, whether they work or not. So there is a paper on a very small study and published. Actually, this paper is when it was put online, because during this period, a lot of the papers that are being sent to journals, some of them have not been peer-reviewed yet. So this paper actually has not been peer-reviewed, but one of the smaller journals put it online, and that's how this paper came out, and that's how people are talking about chloroquine and all that. Now, I think we really do not know whether chloroquine works or not, and although some people believe in it, but I think one has to be careful because chloroquine does come with many side effects if you overdose it. There are issues with eyesight and other complications as well. So I think use it. Usually people use it with azithromycin, but I would put it to you that have to be quite careful because we really don't know whether it works or not. We are not quite sure. But I'm aware of other patients, both from China, because I explained to you, I attended this internet conference with more than 10,000 Chinese doctors, and they were presenting their data that I think the results of some of the antivirals, some seem to work better now. But I think the message they brought across to us who are attending this meeting is that the key is early detection and early treatment, because those who came very late, by the time they were blue in the face, they cannot even walk 50 meters. I think those patients tend to do very badly. But if you come early, some of these antiviral drugs actually do work very well. For example, a patient of ours that we are aware of, he went to one of the countries overseas, came back, had a high fever, 39 degrees, and saw his family doctor. Family doctor says just take Panadol. After 1 week, he was still having high fever every day, 39 degrees. And then finally, I advised him to go to the National Center for Infectious Disease. Certainly, when he went there, for sure, at the A&E, tested chest X-ray pneumonia and COVID-19 positive, got admitted. And the fever was 39 every day. And then he started to have desaturation. In other words, oxygen levels started to drop. And only when they started the antiviral drug did the fever come down. But the good news is that the antiviral drug worked very quickly, and it only took him a few days. In fact, they only gave him a very short course for a couple of days of antiviral drugs. And he was just discharged yesterday. So I think the antiviral drugs, when they use them in an early stage, they work very well. So what I'm saying is that if you're not well, do not like tahan until you cannot stand it anymore. And then you cannot breathe. By the time you go there, it will be a bit too late. So rather, if you're not sure, high fever, cough, feeling tired, chest pain, quickly go and get yourself tested, because early treatment means early results. And that's probably part of the reason why in Singapore, you see that our actual mortality is less than 1%. Yeah, it's about 0.4, 0.5%, very, very low. Yeah.
Okay, Dr. Lim, I think a few patients have asked the same question. Every time we see
Oh, by the way,
Lim,
the ibuprofen and all that, it doesn't kill the virus. Ibuprofen is an NSAID, so it helps to lower the fever, but it doesn't solve the problem. It doesn't solve the problem of the virus.
Okay, a few patients have asked the same question. Dr. Lim, we always see you looking young and healthy and never aging. What is your secret? Are you on some special immune boosters as well? Any special pill you're taking? Are you taking some Indian herbs, Chinese medicine?
Well, I mean, but I mean, I think health is important, and yes, I mean, I do take quite a bit of other things to improve my immunity, my general well-being. But maybe we'll take that offline on a different conversation. Maybe let's focus on the COVID-19 for this. Yeah, but we'll have more sessions, and we will discuss about this of what based on the scientific knowledge, what things can help your immune system, what would improve your health. I think we can take that offline. Now, maybe for today, we focus on COVID-19.
All right, folks, I think we have more doctors, our other specialists, Dr. Daphne Han. I think a few of you have asked about eyes. Is COVID-19, you get infection via the eyes? I've got a general physician that will talk about supplements, etc. So we'll have many more talks coming up. We'll call it a day for today. The rest of your questions, you can text me in terms of courier to help facilitate courier of drugs. We're also working on it. You can call us anytime, 24/7. Dr. Lim is available. TCM medications. I know a lot of you have asked about TCM. We'll have a talk about it as well in the upcoming sessions. I suppose we'll call it a day today. Thank you all. And text us if there's anything. Dr. Lim is ever ready to answer questions. For those with cardiac conditions and concerns, let us know. Text us and we'll come back to you on it. Yeah, thank you all.
Okay, stay healthy.
Stay safe.
All of you stay healthy, stay safe.
Yeah, keep yourselves at home. Take care. Thank you.
Take care.
Thanks, Dr. Lim.
Thanks.